Voglibose is an alpha-glucosidase inhibitor indicated in the management of postprandial blood glucose in patients with type 2 diabetes. In this video, let's found. What is Voglibose? What is Voglibose used for? Contraindication. What are the side effects of taking Voglibose? How does Voglibose work? How to use Voglibose? What is Voglibose? Voglibose is an alpha-glucosidase inhibitor used for lowering postprandial blood glucose levels in people with diabetes mellitus. Voglibose delays the absorption of glucose, thereby reducing the risk of macrovascular complications. Voglibose is a research product of Takeda Pharmaceutical Company, Japan's largest pharmaceutical company. Voglibose was discovered in 1981 and was first launched in Japan in 1994 under the trade name Basin, to improve postprandial hyperglycemia in diabetes mellitus. What is Voglibose used for? For the treatment of diabetes. It is specifically used for lowering postprandial blood glucose levels, thereby reducing the risk of macrovascular complications. Contraindication. Voglibose is contraindicated in hypersensitivity to the drug or to any of its components, diabetic ketoacidosis, inflammatory bowel disease, colonic ulcerations or partial intestinal obstructions, and patients being predisposed to intestinal obstruction. Side effects. In some cases, Voglibose may cause common side effects such as abdominal pain, diarrhea, flatulence, gas, skin reactions, heartburn, nausea, and vomiting. Most of these side effects do not require medical attention and will resolve gradually over time. Pharmacodynamic. Voglibose, an alpha-glucosidase inhibitor, is a synthetic compound with potent and enduring therapeutic efficacies against disorders of sensory, motor, and autonomic nerve systems due to diabetes mellitus. The drug was approved in Japan in 1994 for the treatment of diabetes, and it is under further investigation by Takeda for the treatment of impaired glucose tolerance. Alpha-glucosidase inhibitors are oral antidiabetic drugs used for diabetes mellitus type 2 that work by preventing the digestion of complex carbohydrates, such as starch. Complex carbohydrates are normally converted into simple sugars, monosaccharides, which can be absorbed through the intestine. Hence, alpha-glucosidase inhibitors reduce the impact of complex carbohydrates on blood sugar. Mechanism of action. Alpha-glucosidase inhibitors are saccharides that act as competitive inhibitors of enzymes needed to digest carbohydrates, specifically alpha-glucosidase enzymes in the brush border of the small intestines. The membrane-bound intestinal alpha-glucosidases hydrolyze oligosaccharides, trisaccharides, and disaccharides to glucose and other monosaccharides in the small intestine. Acarbose also blocks pancreatic alpha-amylase in addition to inhibiting membrane-bound alpha-glucosidases. Pancreatic alpha-amylase hydrolyzes complex starches to oligosaccharides in the lumen of the small intestine. Inhibition of these enzyme systems reduces the rate of digestion of complex carbohydrates. Less glucose is absorbed because the carbohydrates are not broken down into glucose molecules. In diabetic patients, the short-term effect of these drugs therapies is to decrease current blood glucose levels. The long-term effect is a small reduction in hemoglobin A1C level. Half-life. The half-life of Voglibose is very similar to the one found for metformin, and it is reported to be of 4.08 hours. Dose. In non-diabetic hyperinsulinemia and steroid-included diabetes, Voglibose can be given in a dose of 0.2 mg TID before meals. Safety advice. Voglibose falls in the category of B drugs used for pregnant women. That's all the information about Voglibose we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.